What's up, everyone? It's Dr. Glenn Bowe. I am here with the man himself, Dr. Swole, right here. Dr. Swole, now it's Dr. Max here.
So before we get into our episode, I'd like to give a shout out to Mango Voice, one of our premier sponsors. Mango Voice offers voice over IP phones for dental practices, but it's so much more. Go check them out and make sure you ask for the Nifty Thrifty deal.
I mean, you guys probably see them on social media and whatnot, and I had to bring him on. We're not talking about workout tips, although I want to get some workout tips right there. He was telling me, he was like, I got to keep working out because I have a young son. I got to show him what's up. I got to show him what's up with the old man strength. I was like, I hear you, brother. I'm going to try to do my same thing. But we want to talk about marketing. So you got unique. I think, to say the least, marketing technique. And I'm going to just jump right into it.
Go for it.
You had a couple of adult entertainers.
I've had a
dancers and whatnot. And you posted out and you're like, look, dude, like they need dental care too, man. Why are you hating on that? And I was like, Max, you're getting on a podcast, bro, and you're gonna explain that. So first of all,
let's talk.
Let's just address the elephant in the room. You know, you have a lovely wife,
Beautiful wife.
you have a, just like a strong son. Like he's a baby, but he's strong. You can tell
He looks like Bam Bam. So
he's
he's Bam Bam.
But you got like an amazing family life, right? So obviously, if you're, I want to know like how that went over when you decided to kind of do that type of market. How did your wife feel about it? Talk about that.
Well, I met my wife. I started the marketing first. Okay. So let's talk about that. I decided one day it's time for me to buy a dental office.
Yeah.
It wasn't working out for me anymore in Fort Myers. I said either push come to shove. I'm 32. I'm single. If I don't do it now, when am I going to do it?
Yeah.
So I bought this office from another gentleman who, frankly, he did some pretty bad things.
Oh,
He did some pretty suspicious things with his life and his practice.
yeah.
And
Fraudulent things?
should I get into it?
Nah.
Okay.
Well, it wasn't fraudulent, but it was next episode.
It was unethical.
Okay.
So I bought an office at a good price, and I pretty much was starting from fresh.
Yeah.
Because what he did the next day after I purchased it is he told everyone where he was going in West Palm Beach, and I just had a massive exodus of everyone out of my office. They were calling me on weekends saying, I want my records right now. I want to go.
So essentially what you're saying is you bought an office that you thought was an established office, and overnight it became a startup.
Yeah.
Jesus. Okay.
So when you wake up feeling poor every morning,
Yeah.
when you wake up truly feeling poor, you say to yourself, what do I need to do in order to do something?
Yeah.
Like just to make the rent, to pay your staff. So this was in 2009 in the height of an economic recession.
Yeah.
So you're having massive foreclosures on homes, and people are it's just a tough. So I noticed the patients I did have, and I said, well, who has money? And who has money during this time? And who is able to pay for dentistry?
Yeah.
And as we've heard today, a lot of people view dentistry as an elective procedure.
Yeah.
So I said to myself, the people in my area in South Florida, we didn't have OnlyFans yet, but I was like, what do I have in my area that people are successful? And I said, I'm close enough to the Wilton Manors area. Are you familiar with that?
Yeah.
Okay. So I'm close enough to a gay clientele.
Yeah.
I'm also close enough to a series of strip clubs in my area.
Yeah.
And I said to myself, these are the people who are coming in. Frankly, I had one girl, when we told her the price, she said, can I pay you back in lap dances? And I was like doing the math in my head. That was a lot of lap dances. And I said, no, thank you. I tried to be very, very cordial. But we started marketing.
Hey, you can't fault a girl.
What's that?
You can't fault her, man. You know?
I appreciate the hustle.
True entrepreneur.
Yes, I appreciate the hustle. But what we started was I went into two different directions of people who hopefully could afford dentistry. So we started marketing towards a gay clientele.
Yeah.
I found the largest gay magazine in South Florida. I was working with another local magazine, and the guy that was selling me ads, he happened to be gay. So I was like, what's the biggest gay magazine in the area?
Yeah.
So that led me ultimately to Hotspots magazine in South Florida. So I became friends with the publisher. Turns out he came to my office. We started doing an interview, started talking. He's from Brooklyn. I'm from Brooklyn. He's Jewish. I'm Jewish. So we had a lot of commonalities. In fact, him and his partner came to my wedding. Fast forward years later.
Wow.
They become very, very dear friends.
Yeah.
And I said, I have an idea for Hotspots magazine. I don't know how you would be offended or anything else like that. And he said, okay, what is it? I said, well, I don't know. And I said, I have an idea that we'll make your teeth straight even if you're not. And that was my first ad in gay magazines.
Say that.
I didn't talk about this. We talked about some other stuff, but
Say that one more time, because that is like money.
My first ad in Hotspots magazine at the time was, and I said, I asked for his permission because I didn't want to overstep any boundaries. I didn't want to be politically right.
Yeah.
And he actually said, well, have you seen our magazine? I was like, no. It's like, trust me, you'll be fine. But it was, we'll make your teeth straight even if you're not. And then we went from that to another promotion we did was whitening $99, the whitest teeth your boyfriend will come across. And we, so you want me to repeat that one also?
No, I think we're good.
Okay, yeah. So we started marketing to that clientele and we got an instant response. And that was truly something versus any other types of magazines when we were print at the time, not social media, but at print, that's where we began.
Let me ask you this.
Yeah.
Were you the only dentist who was advertising in that magazine?
I was the only straight dentist.
Yeah.
And I did get some pushback from my colleagues who didn't feel it was appropriate. And I took it from the perspective that I was supporting a community that was already supporting me. And why not? I have a friend who's Indian who asked me if it was appropriate if she advertises in the Jewish Journal, knowing full well that I was Jewish. And I said, I do not care.
Yeah.
We live in this country, we're capitalistic, and we should market towards everyone. But again,
every community needs dental care.
You look at this ocean of patients in front of us, and why not focus on groups that are good to me and give back to that community?
Yeah.
And since then we've supported different events. I also support the arts with Avenue of the Arts.
Yeah.
But another realm or another path we took, which is what prompted this, was we started marketing towards Cheetah, Vixens, and all of these other strip clubs. And we started putting flyers in different clubs saying, look what just fell into your lap. Exam x-rays and cleaning, $89. So that's been the other avenue that we've gone. I mean, there are other avenues we're working on, which I talked to you about earlier.
Yeah.
But this was the beginning of trying to build an office in an area. I mean, I also market towards, and those two things, by the way, led to other things.
Oh, yeah.
That wasn't just like, we just did this, we did this.
I mean, guys, I want to make something clear here. And I love it. And for those who are watching right now and you're thinking about passing judgment, I want you to think this. You need to think outside the box. This is what this gentleman did. He could have just closed his office door and just started crying in the corner somewhere. And he was like, no, I want to think outside of the box. And a lot of times if you're in an area and you're starting from scratch or you're in a saturated area, you got to think outside of the box. So I want to let everyone know and be clear is that, yeah, you take care of this community, but you also we see normal soccer moms or normal families as well. You're not just focused on one.
Never. No. We have a good patient base, but we had to start somewhere.
Sure.
And I had to hustle. There was also networking events. There was a lot of different events that I still do.
Yeah.
But the greatest inspiration to me at the time was a gentleman by the name of Larry Kawa. I don't even know if you know who that is. He has one of the largest orthodontic offices in South Florida.
Yeah.
He was the official orthodontist for the Florida Panthers. And he was the one that would brainstorm with me and help me. It wasn't just me.
Yeah.
I used to work for Procter & Gamble. I used to work for Hearst Publications. I did event marketing. There was a lot of, look, I don't know how, you know me from this.
Yeah.
But at the end of the day, I am a bit of an introvert. But you have to say to yourself, when you have to support your family, you need to do what you need to do in order to make sure your family is okay. So this was the beginning in 2009.
Yeah.
From there, what stemmed from that was just blessing after blessing.
Yeah.
We became the dentist again, we're in South Florida. From that, from not just advertising in hotspots and advertising in different clubs, but I got on staff with Broward Health and Imperial Point Hospital. And the combination of all these things, I was the only general dentist because I walked in the emergency room. I said, what do you guys do if anyone comes in and has a toothache?
Yeah.
I said, we don't know. And I said, can I get on staff with Imperial Point Hospital? And between me being on staff with the hospital, the only general dentist, by the way, at one point, the only dentist, period.
Wow.
At a hospital and advertising in these markets, everything came together because it is South Florida and there's an amalgamation of people.
Yeah.
And I get a phone call one day saying, we need a dentist to help out. We have Carnival Cruise Lines. Broward Health has Carnival Cruise Lines.
Yes.
And we need someone to see them on the weekends. So all of a sudden, any employee on a ship, and Carnival has more than one ship.
Oh, yeah.
So we started seeing some people from the Philippines, people from Thailand, people who would work on a cruise ship who are trying to have a better life
Yeah.
payment-wise on a cruise ship than they would back home.
Probably never been to the dentist before. I probably rarely go to the...
Severe smokers, no flossing. This morning, I was in Fort Lauderdale. I saw a patient from Mexico City, and I saw a patient from the Philippines. And we took care of them. Now we have Disney. So we're working on Disney Cruise Lines now. But all that came from the benefits of Broward Health, marketing to these communities and putting 2 and 2 together, and people calling me from these different avenues. But it all stemmed from somewhere. And if you hustle, and not just from sitting on your you-know-what and just praying that something's going to happen.
Yeah.
That's the difference between PG-13 and rated R.
Man, it's
either going to happen or not.
Oh, man, I love it. I love the message so much because, I mean, you and I, we got connected on social.
Really?
We got connected. But we also... There's a good and there's a bad, right? And the bad is, like, sometimes people will come in there and they'll start complaining about the situation. And look, we have empathy. We feel bad for them. But at some point, you got to do something. At some point, you got to do something. I love the fact that you were dealt, like, it's just horrible what happened. But you're like, you know what? It is what it is.
No, you and like, you don't even understand.
Yeah.
My dad just died. My mom had no support, so I was supporting my mom, living at home, paying her mortgage. I had to take care of I still take care of my mom.
Yeah, yeah.
Like when you see on these social media groups about, oh, what watch am I going to buy, or what this, what that, my hustle was not, let's be very clear, my hustle was not for what Rolex or what Omega I can purchase, or what Patek Philippe. It was to make sure my mother has long-term care.
Yeah.
My mom has a caretaker 5 to 7 days a week. You have to understand where my place came from. Was I'm a child of immigrants that came to this country, and the family first, man. It'll never be about the next car. I drive a Santa Fe. I get offended when a patient says, "I'm just paying for your next Porsche." No, one, I would pay for my own Porsche, which I don't have. I'm paying for my family. Yeah, and that you have a couple of kids also.
Yeah, I love that, man. I love that. Such a great message. But again, a lot of times, look, there's going to be obstacles, right? There's also, that's why I love stories like this, because, again, you might be in the same situation. Maybe you're facing a thing, but know that there's other people out there. Now, for those who are watching this right now, they're like, man, I like a story, man. I want to reach out to them. I mean, what's the best way for people to get a hold of you? Because look, luckily for me, I'm friends with those. I could DM them anytime and we can talk like that. But what's the best way if people just want to, maybe they've been going through something, or maybe they have some advice and they just want to ask you for advice. What's the best way?
Well, as you know, I have nothing to sell. You just asked me to come on here and talk.
Yeah.
So
he has nothing to sell. Literally, I just like his story, and then at the end, I just bring him on there. But naturally, people are going to be like, man, I want to reach out to this guy. I want to talk to this guy. What's the best way?
Facebook, Matt Zaslavsky, Instagram, My Social Dentist, LinkedIn. I'm on all the major ones.
And he's in the Nifty group, right? So if you're watching this, just drop a comment when we drop this here. He'll probably say something like that.
I'm more than happy to help in any way. I mean, I don't know if I'll be the best, but I'm there to help. I appreciate his time. We like talking. I appreciate talking. Yeah. But I'm here to help in any way. And life is tough. And if you're going through something, you're not the only one.
Yeah.
Trust me on that. You're not the only one. We're all going through something right now. And from the outside looking in on social media, sometimes it feels like everyone has a perfect life, but it's not true. We're all dealing with bills and life and family.
Yeah. Well said. And guys, if you're wondering about, we want to get some guns like this here, that's another episode, man. But man, thank you so much, man. Guys, reach out to him. I'll tag him in this post, and hopefully he can help you guys out. See you guys next time.
Take care.